The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice.
Hey, it's Nikki. Thrilled to hand the mic over to our friends at TestRx MD. You might remember David and me sharing our pretty in-depth health journey last year, from a devastating diagnosis to our taking health by the driver's seat. We chose to partner A to B first with the health professionals that have helped us most. Collectively, David and I, we lost over 60 pounds, and so many other aspects of our health have us feeling more lively and confident these days. So look, we're on a learning journey with you, and we know you agree. Health is so crucial to our ability to live our best lives. P.S. Don't wait to hit this team up at TestRx MD for a free concierge coaching call. There's a link in the show notes, or feel free to ask us. But this action could be the start of a whole new you. It was for us. So I'm passing the mic to our partners at TestRx MD.
Hey guys, welcome back to Activate Your Best Health. This is part 2 in the Peptides Masterclass, here with Dr. Saddoris as well. Today, in the second iteration, we're going to be covering 2 more segments, one based on healing and regeneration, and then cognitive enhancement. Next episode, we're going to be getting into more lifestyle changes to just have better overall well-being, and a lot of things that go into that, but that's for next time. So let's dive into a fascinating comparison between 2 powerful healing peptides, PDA, pentadecapeptide, and BPC-157. Dr. Saddoris, can you break down what makes each of these unique and how they complement each other?
Yes, this is exciting topic because both peptides amazingly are structured very similarly, but the PDA does have an arginine component to it, so it gives it some different properties. They both deal with healing and recovery, but in different mechanisms and sometimes in terms of repair for different organs. And we'll later go into those comparisons of which one might be better for what condition. But I'll start with the PDA. It's found in your outside of your cells, and it's found to increase fibroblast activity, which is a form of recovery that you need, and enhances collagen synthesis. And it also causes angiogenesis, which is increasing your blood cells, your blood vessels going to your structures in your body. That increases improved nutrients to cells, but also it helps improve eliminating toxins out of the cells, especially when you've had injury. And it also reduces inflammation. And inflammation is always kind of a destructive process. And so it really does help reduce that and help with tissue repair. The advantages of the PDA is that it is very superior in collagen production. And so we tend to like to use this product more for anti-aging, like skin and body. It helps with the creepy skin that you can get. It helps reduce wrinkles. It just enhances your skin appearance. But it also helps your joints to be more flexible, less prone to injury, and also helps with tissue repair. So this is a great product to take for just general wellness, okay? You don't necessarily have to have a specifically severe injury, but it helps you keep from getting injured. Like if you're a bodybuilder, it might help prevent or reduce the injury that you're creating with lifting those heavy weights. It also helps with mucosal healing, like things in your lining of your mouth, but also in your intestinal tract. So it has really strong benefits for this anti-aging process. It's also extremely well tolerated. I don't think there's really any significant issues with it at all in terms of taking the medication, which is a great thing to know because, a lot of times some drugs can have drug interactions. Which this one does not.
So one thing too, in my research, I just want to stop you real quick while it's just on the top of my mind. From my understanding, I think that PDA is better for joint and tissue repair as well than just normal BPC. So especially how BPC varies between the injectable and the oral, those have 2 completely different effects, but it's also more systemic instead of just joint and tissue repair. So I feel like post-surgery, the PDA could be a better option as well. Is that correct?
Yeah, I mean, we'll go over all those, like if you've had surgery or if you had an injury, which ones might be a better option for you. But I do think that, they each have their distinct things that work a little bit better. But, generally, they both kind of cross react and do similar things. It's just that one is a little bit better than the other. Like BCP works more for tendon and ligament repair, whereas the other one might be more muscle strengthening and injury to the muscle. And, so sometimes when you think of a muscle, you don't realize that there's different parts of it that may do better with one or the other. So it depends on the type of injury that you're dealing with.
Gotcha.
So, and then BCP 157.
BPC.
I'm sorry. I thought I said P. I followed BPC 157 is also a protective compound for the body. It does accelerate wound healing. It protects the organs. So it's more of more severe injuries that you're encountering, especially with a lot of inflammation. It's very strong anti-inflammatory, so it's even more potent than the PDA. And it also targets the gut-brain axis. So it does have neurochemical responses in the brain, which sometimes has an effect of improving drive and decreasing depression symptoms. It does stimulate some growth, the expression of growth hormone. It doesn't necessarily stimulate the increased production of it, but at the tissue level, it makes the growth hormone become more effective in what it's supposed to do. So it's very complementary as a treatment with that. The other thing is that it does give you more rapid recovery from injury. I know I had a guy had surgery on his shoulder, a torn rotator cuff. He gave him an injection. He saw his doctor a week later and he was amazed. He says, I've never seen someone recover so quickly. And his pain was gone. He was having good range of motion. I did tell him, though, do not lift weights and give yourself some time for your body to fully repair. Strong gut healing. I mean, people that have inflammatory bowel problems, inflammation of the lining of their intestinal tract. A lot of people with COVID have developed these kind of weird diarrhea issues and abdominal complaints. And again, that's an inflammatory response. You may have a leaky gut situation, very healing of that lining, and also the inflammation going on. And then we talked about the tendon and ligament repair, which is different than the muscle building and repair of the muscle. And it does have the neuroprotective effects, which the PDA doesn't seem to have as much, kind of protecting the brain from injury and just general systemic healing benefit, just because it's reducing inflammation. And inflammation affects every cell in your body. So it's not just one spot that's causing trouble and you have inflammation. Your whole body is a chemical process. Your whole body's involved, and it has an effect of helping with that.
So we've discussed how these peptides are very complementary and they do very similar things. So now let's get into, like you just mentioned, the dosing side of things. So how do they compare there? Are they very similar on that end too?
They're really different in dosing in terms of the amounts that you're giving. The standard dosing of PDA is 1 to 2 milligrams daily versus BPC 157 starting as 250 to 500 micrograms, which is 1,000, more than 1,000 times less. And the PDA, what's nice about it, it's once a day, and it has the options of being oral, so you can take it for your gut health, or injectable, which can be for deeper tissue. And they also have topical for skin and for scarring. And usually you take it 4 to 8 weeks. Some people say that, hey, I've seen improvement within a couple days. But I usually say, give yourself a week and then see how you're doing. And then you could go up on your dose if it's still having a lot of problems. You can split the dose and take half of it in the morning and half in the evening, or you can take it all at one time. If the injectable, poking yourself twice a day may not be as pleasant, but then again, you might get more even, consistent levels by doing it that way. The other thing is that when we're looking at doses, we kind of have to look at the person's body weight and then generally what condition we're treating. How severe is it? And then we have to decide, do we want to go topically? Do we want to go orally? Or do we want to go injectable? And then we have to also monitor the response because every person responds differently to any kind of medication. And so we need to see, do we need to go up, keep it where we're at? Maybe you're having side effects, maybe reduce it slightly. Like the mentioned before, the PDA has very minimal side effects, if any. So the general oral dosing ranges that we're dealing with, and this is for the BPC-157, sorry about that, is typically between 200 and 300 micrograms that you're taking a day. 200 to 500 micrograms a day orally generally is what we go with. But you can go as high as 500 to 1,000 micrograms a day. Now, orally is always going to be higher than injectable because you get less systemic absorption with it. So injectable is a little lower. It's 200 to 300 micrograms generally, and you can go up to 300 to 500 injectable if you need to. But it all bases on how a person's responding. And we usually always recommend titrating for a couple of reasons. One, it reduces side effects. And so if you're having a side effect at a lower dose, your body gets used to it and you don't have it and you can go up higher. The other is that we want the lowest effective dose that works. That way you reduce side effects again, but also it reduces cost. If your medication can last you longer, then you're paying less amount for it, right? You can cycle these. Usually 4 to 8 weeks you have it on, and then you want to be off 2 to 4 weeks. So then that you don't develop tolerance, and that usually gives you the better responses that you're dealing with it. And again, the BPC does work better taking it morning and night versus just once a day. And so there's a little difference in how it's dosed, but they both are very effective for the problems that you're looking at.
Awesome. Well, that was very detailed and granular. I love that. Now comes the fun part, the stacking protocols. So I know already that people can already probably guess one of these stacking protocols because we've highlighted 2 in the compounds. But how can these peptides work together or with other compounds? And where have we found success at My Body Health and Wellness?
Yes, I think that, PDA and BPC works very good together for a comprehensive. So the muscle is one structure, but one works on one part and one works on the other. And so sometimes when you injure your muscle, you've also injured your tendon, so you're kind of getting the whole comprehensive treatment that you're wanting to get. And so you get very more enhanced tissue repair, faster recovery. They do dose it a little bit differently, just because the combining together, you don't need the maximum doses that you used individually. So the PDA is 1 milligram and the BPC-157 is 250 micrograms twice a day. And it's usually best for serious injury or post-surgery. The other stack, I don't particularly like using for like general wellness or healing processes. But some people use this, that are more bodybuilders wanting to build up muscle and bulk. The PDA plus the TP 500 stack. And that's a type of protein that increases muscle growth and tissue repair. But it's more for performance. Sometimes athletes tend to use that. It is something, though, that is banned in sports. It's considered doping. And there are some concerns. They don't have as many clinical studies on it. So we don't really know long-term effects on a person's body on that product combination. But, they do say that maybe there's increased flexibility and endurance. And so a lot of, athlete performers are interested in using that. But unfortunately, if they get caught, they're kind of in trouble.
I think the big thing there is the recovery aspect. So they can go hit a hard workout go do the Tour de France, get on a crazy cycling ride. And then instead of taking, 3 to 5 days, week or whatever to recover, you could bounce back in a day or two potentially, right? Obviously everyone's different, but yeah.
Yeah, but it does give you a quicker recovery. So the dosing with that would be the PDA 1 milligram and the TB 500 is 2 to 5 milligrams a week. And you could go up higher on that. The other one that is commonly used because of its anti-aging, especially of the skin combination, of using the PDA plus the BPC-157 plus the GHK Cu, which is a copper compound, and copper peptide is involved in a lot of enzyme activities in the body, but it increases collagen and elastin, which is something that's critical for maintaining skin to be firm and flexible. Like I said, it does help with the crepey skin that you can get. It helps with the wrinkles reduction. It's kind of, some people call it the youth serum, using that to enhance their appearance of being younger. And, they all work together and increasing wound healing, decreasing inflammation. It also has a protective effect on the cells from oxidative stress, especially like from sunlight or chemicals that we use on our skin, because oxidation is what causes damage to the cells, and so it prevents damage to it. And then it also protects the brain from oxidative stress, which is, like when there's processes in your body producing energy, they produce these free radicals, which then cause damage, and it's called oxidative stress, to the cell's membranes. And that damage is always, when it gets repaired, it never works as well as it did before it was damaged. If you're using like the cream version of this on your face, I'm told it takes about 12 weeks to see significant improvement. You might get a little magnifier, you might see a little less fine lines or thing like that earlier, but to see significant improvements at 12 weeks of applying that every day. And it does increase something called stem cell proliferation, and then also differentiation back into whatever cell it needs to be. So it produces more of what you were when you were a child, that the cells would recover and quickly repair itself. And you need those stem cells to do that. And as we age, stem cells dramatically drop as we age. And so I don't know if anybody has heard of treatment of infusing stem cells as anti-aging.
Yep.
It is something that's expensive, but it is very effective. If you didn't have to go out of the country to get it, I would be almost tempted to try it myself. But it hasn't come to the United States yet as a recommendation as an IV therapy, although they have used stem cells in creams that they use for hair loss and things like that. So those are great. Also, you do need some support vitamin-wise if you're going to be wanting healing for things like vitamin C is critical in enzyme activities. It also helps with anti-aging and collagen production. Zinc is so important, but also helps with your male and female hormones to function better. Collagen, again, helping to have the nutrients, because if you're trying to increase collagen in your cell, but if you're not taking enough collagen in your diet, you're kind of wasting the benefit of what you're having. So I think those are the best combinations out there and what they're used for.
Awesome. That was super helpful. Now let's get into some specific applications and why you would choose one over the other for basically targeted conditions.
Yeah. So, soft tissue injuries, if you're having a chronic condition, then PDA is better. One, it has more even levels. It sustains better. It has really minimal or any side effects to it. So we're not seeing any particular problems to develop with it. And so that's excellent. But if you had an acute injury or a surgery, or if you've had, some trauma to your body, then the BPC-157 is excellent for acute injuries. If you're having gut problems, the best product is the BPC-157 orally. That really helps with, inflammatory bowel disease or stomach issues or gastritis or anything that's inflamed and irritated and just not responding right, like leaky gut. And then if it's just mild and just kind of the mucosa has been a little bit irritated, let's say you had a viral infection and you had a little gastroenteritis and kind of inflamed a little bit in the colon, then the PDA would probably work fine with that. You wouldn't need to have the super duper strong version of the BPC product to help with the gut. And then sometimes you combine them both if they're really severe. The skin regeneration, as I was recommending before, was the PDA, the primary choice, or using the GHK copper, or using those two together would give you great skin regeneration. You could use the BPC-157 supporting, like, let's say if you've had damage to your skin, like maybe it was burned, or you had like a severe allergic reaction and your skin's been sloughing off, and very red and inflamed, or very severe sunburn, that maybe using that for the acute injury would also may be beneficial. And then we talked about the joint and tendon. The PDA works for collagen because in the joints, especially in the knees, you need the collagen to be cushions. But you have them in other joints too. But if you're needing the repair for it, the BPC-157 gives rapid repair, and then you use them together for serious injury.
Awesome. That was super helpful and very enlightening. What are the safety considerations or contraindications with these peptides?
So basically, contraindications, I think, for most of these peptides is if you have any active cancer. I mean, if you're promoting cellular growth or improvement, if you got a cancer there, you're improving its growth as well, so you don't ever want to have active cancer. If you're pregnant or nursing, I mean, that's pretty much, you don't want to take anything, any herbal products or any kind of unnecessary products. And then because they kind of work on inflammation, if you have a bleeding disorder, sometimes it could aggravate that, especially the BPC-157. It can also affect that product, can affect the absorption of certain medicines, because if you're taking it orally and you're also taking another medication, it might affect that absorption. Especially if it's inflamed and stuff like that, it might initially not be working very well, so you're taking higher doses of something. And then once it gets healed, now it's being absorbed properly, and suddenly you have a huge amount of a blood center in your system that you previously didn't need as much. And so those would be kind of tricky. And then if you have an autoimmune disorder, that would be kind of individualized in terms of how aggressive it is and what else is going on, basically case by case. And I already mentioned the side effects of the PDA is very minimal. The BPC-157, as I mentioned, it can affect medication absorption. And it is kind of an interesting product. If you're taking it, you have high blood pressure and you're taking it, it does lower your blood pressure. But if you have normal blood pressure, it might cause a slight elevation. So, it just needs to be monitored. It's just kind of a little crazy there. And then we had talked about previously a combination that I think would be a great one, because John had mentioned what would be one of the things that you would want to take overall as a great combo. And I would say the PDA with a growth hormone secretagogue, such as the CJC-1295 or the Semorlin or Ipamorelin. And that way you would get the full benefits of muscle growth and repair, but also reducing injury and regeneration. And I think that would probably be my best combination. I kind of left that towards the end just so you could kind of hear the different other products there.
Awesome. That was very helpful. Now We're going to wrap that segment up and move into the cognitive enhancement section, which is honestly also one of my favorites. So our final segment covers two powerful nootropic peptides, Semax and Selank. Dr. Saddoris, can you explain why these peptides are often discussed together and what makes each one of them unique?
Yes, they both have similar effects, but some have more effects of certain parts of the body than others. What I really like about these two products, especially when I'm dealing with the Cmax and the Selank, is that, people are under stress. They are so used to stress, they don't realize that they're stressed anymore. And when the brain is not having the ability to relax, when we go to sleep, we think our brain's resting. No, it's actually working actually harder than we're awake because it's processing things and putting things away in different areas in the brain. So when does the brain get a chance to rest? And so you kind of know you have a problem if you're a procrastinator, because we deal with stress by, I can't take anymore. What I have to do today, I'm going to put it off to tomorrow. And then, of course, tomorrow, and then finally you're at the deadline, and then you're even more stress. If you're having to find you have to take something to relax, you have to take something to get your mind off of things. If you do these endless games, on your phone or on your computer, that you're needing to have distractions to somehow you're trying to ease the stress. But these are not productive ways of helping you. They actually create more stress because you use up all your time on these things and not deal with the situations that you need to deal with and be successful in what you need to do. And so I think both of these products, though one may be better for stress than the other, is great for people that may not think that they have anxiety or stress, but they are. So I'm going to go through first with Cmax, and then we'll go with Selank. Cmax is a nootropic peptide, and that means that it works on the brain in terms of protection. It helps with neurodegenerative diseases such as Parkinson's, Alzheimer's, ALS, people with strokes, cognitive disorders, we're trying to remember things. All of the things that we think is aging, this is very protective on the brain. And it protects itself by basically enhancing the production of two major peptides in the brain. And one of them is called BDNF, which stands for brain-derived neurotropic factor. So it's basically stimulating the nerve cells to produce more. And these nerve cells have these little things that stick out from them. They're called dendrites. And those are what causes connections from one brain cell to the other. And as we age, they shrink back and sometimes they go away entirely. And those connections really affects our memory and focus and concentration. So they stimulate those dendrites in the brain. And so that it helps with that. And then the other one is the NGF, which is nerve growth factor. So it's actually increasing the number of nerves in your brain. So as we age, our brain mass drops because we're not producing as much nerve growth factor. And so we get a shrinkage of our brain mass. And you can see that on a CAT scan or an MRI of the brain. So it does help with increased attention. Both of these products increases memory, increases emotional stability. It supports the brain, like when you've ever had a stroke, the outer part of the area of the stroke are cells that are going to die, but they're not dead yet. And I think they're really recommending using this product if anyone's had an acute stroke, because it helps preserve that. And maybe some cells that we think are dead in the stroke that just might be really struggling and not showing activity, it might even improve that. So it can really decrease the significant severity of any stroke. And so for anybody with ischemia, there are some other uses, which is kind of interesting. They have used it for ADHD, for helping with memory and focus. And then opioid withdrawal symptoms. And I'm thinking, how does that work? But it does have an effect on their dopamine system
And serotonin, right?
and
So I think
serotonin.
that's what it is. Yeah.
Yeah. And it's like, whoa, how does this affect withdrawal? I'm an addiction specialist, and I'm thinking, why, how does this work? And then, of course, I already talked about the Alzheimer's, Parkinson's, and ALS. Now, Selank is a product that they're both used in a nasal spray. And Selank actually works with people that have a lot of anxiety. And what they say, it modulates the GABA system. The GABA system is a part that either helps calm you, and the opposite is it causes excitation. So when it's in excited form, you form glutamate, and constant excitation in the brain with glutamate, it causes irritability and sleep issues and nervousness and things like that. And the GABA part is the calming part and relaxing part. And that's where we get gabapentin from, because it stimulates that part. And so it's kind of similar to taking a benzodiazepine, because it also stimulates the GABA receptor. But the difference is that the Selank is not addictive, nor does it make you sedated. A lot of people like the benzos because it kind of makes them feel dopey and loopy and sedated. But if you have to work or drive, that's not a good state to be in. And nor does it create, this weird nighttime doing things that you're not aware that you're doing them,
Sleepwalking.
Exactly right. Getting yourself into trouble with that. It doesn't cause anything.
I have heard too that with Selank specifically, that it can be a direct replacement for benzos, which would allow people with anxiety issues to not have to worry about the addictive properties of some of those compounds. Is that correct?
Yes. I think the biggest problem with benzos is that you kind of like that feeling of loopiness, and you think that that's caused as the benefit. And they don't realize that you can have the anxiety released without the loopy feeling. And so if you're going to drop yourself off of the benzos, you should taper, especially if you've been taking it chronically so you don't develop withdrawal seizures. But definitely in terms of anxiety, as long as you let them know you're not going to feel loopy from it, but you're just going to not feel as anxious. So people kind of, a lot of times people will tell me if they take a medicine, if I feel nauseous, I know it's working. It's like,
And that's awesome.
it's like, it's just that they associate this physical response to how the medicine's working, and not realizing that's a side effect rather than the actual medication effectiveness.
Right. So this could be part of the titration schedule to step someone down off as well.
Definitely. And I personally think that this would be a better product than ever to start someone on a benzo in the first place. Then you don't get into trouble in the first place.
Definitely. I do think that one issue that we have seen is it touches basically on things that you just mentioned, where if someone is looking for that quote unquote loopy feeling, they're just going to increase their dose on the Selank to try to achieve that feeling, and then not understanding that that's not necessarily how this works. So they need to be very cognizant of that.
Exactly right. And you won't get that feeling even if you keep overdosing on it. But it does balance serotonin, which is used, mainly for depression and anxiety. So it has that balancing there. And then it does have some things of enhancing their immune function, and it helps them be more stress resilient, meaning they can cope with stress better on it. They don't tend to get, like some people are like on a fine edge. You say one word and they're off like that. It kind of lowers that threshold of stimulation, because when stress happens, you get this flood of chemicals in your body that you're not aware of that just triggers all kinds of negative things in your system. And so it helps, lower that whole process. And so, that's what Selank does. So when you're looking at benefits between the two, the Semax, as I mentioned, enhanced focus, concentration, improved memory, better mental clarity, so you don't have that brain fog that some people describe. increased learning capacity. You tend to learn quicker.
So could Cmax then also be used, because you just mentioned brain fog, could that be used for people post-COVID to combat the brain fog?
I think it's worth trying on them. Of course, we don't, COVID's fairly new, in terms of how long it's been around. But, a lot of people with fibromyalgia, have complaints of brain fog and things like that. And so I think that anytime when you feel like you just can't focus, I think this is a great product. And again, as I mentioned, it's the neuroprotective effects that's going on in your brain. So let's say you have some inflammation. I mean, they are showing inflammation in the brain. It's associated with developing Alzheimer's, okay? And so maybe even taking this as a potential protective effect, I don't know, but to me, mechanism-wise, sounds like that could be a benefit, but it's not been studied. It's just my correlation in my mind of how that may or may not help. And then as I Selank benefits is that reduced anxiety and reduced stress, and also more, not up and down as much. And it also can help increase, cognition too, without using a stimulant. And so, you don't have to take an Adderall or something like that if you're not have ADD or ADHD, but you like the effect of Adderall of helping you stay more focused or concentration. Both of those would have that mental alertness component.
Let's discuss optimal dosing protocols now, so people know how much to dose on each one of these.
Yes, they're very similarly dosed. It's a nasal spray, so the standard dose is 250 to 500 or 600 daily, can go up to 900. Usually that's typically is 1, 2, or 3 pumps a day in your nostrils. And usually you can take it morning and early afternoon. And usually you can take it 4 to 12 week cycles and then probably off for about 4 weeks, just so, again, you don't develop any kind of tolerance. And the dosing is the same for both Semax and Selank. And so, I did have one of my patients with addiction. I don't know, what was he using, 9 times a day or something like that?
That was one of the cases that I was specifically referring to for the Selank with benzos.
So we can stack them. You can use Semax and Selank together if you want to have comprehensive cognitive improvement, and also to balance your mood and focus and anxiety. And usually you do a little lower dose. It'd just be 1 spray of each of them twice a day, usually morning and afternoon. And then they also have an advanced cognitive stack with both Semax and Selank, and they have what's called NewPep. And it's a type of supplement that does activate that brain-derived neurotropic product and your nerve growth factor. But it also helps accelerate nerve regeneration, and it's anti-inflammatory. It improves memory and recall, and it also increases dopamine in your brain, which does help with focus, concentration, and motivation, at the same time lowering anxiety. So that's kind of a nice combination.
I will say this from personal experience and from cases with patients, people need to remember that Semax and Selank together potentiate each other's effects. So even though Dr. Saddoris just mentioned you're taking 1 spray of each, the actual effectiveness of those would be like the equivalent of 3 sprays, right? It's going to give you more of a benefit than just 1 and 1. I just wanted that to be very clear.
Yeah, they're very synergistic in terms of how they work. And since they're working on similar sides, but in different ways, it is giving you a much greater effect than just one. Rather than 1 + 1 is 2, 1 + 1 is 4 or 8, type thing. And then, there are a lot of herbal products out there that people can use together with either Semax and Selank. Some will use like Semax and lion's mane, which is a type of mushroom that also enhances focus and concentration. And that's been around in ancient medicine for a long time. So It's been shown to be very beneficial. A lot of people really like these different types of mushrooms. They have different chemicals in them that have effects in the brain. And in the afternoon, taking the Selank and then the L-theanine, which is seen like in like green tea or matcha or white tea. And it has a decreasing stress and anxiety and depression. So it complements the Selank, calming effect. And so that's sometimes people do those together. And you can kind of structure that around to when you need to be more alert, which is when you want to use the Semax, and when you want to take the Selank, when you want to be more relaxed. People have different schedules, and sometimes you can tweak that. And then the stress management, using the Selank, and then ashwagandha, which is ashwagandha. I'll get that out right. That also is an herb, and it decreases cortisol. And cortisol is a hormone that is released from stress, and so it tends to help block that stress response, and it reduces the anxiety, has anti-inflammatory properties, but it also, improves sleep quality. And, a lot of times, people take medications that make them druggy, but it doesn't necessarily improve sleep quality. You've got to go through the reparative phases of your sleep. We always hear about REM, which is important. That's the processing part. But then in the slow wave ones are when you're getting the reparative or regenerative phases. And if you're not going through those phases of your sleep, then you're getting poor quality to your sleep. And so it's important that anxiety, the stress response system, is very critical to be under control to help reduce these things.
Awesome. What about specific applications and targeted conditions between both the Selank and the Semax?
Yeah, so for cognitive enhancement, the Semax by far is the best, but you can combine it with the other to get the synergistic effect. If you're dealing with anxiety, again, the Selank is the best product. Again, Semax can be added into it to help deal with some of the other mental issues and balancing things out. But if you want work study performance, the Semax, great for cognitive boost. But if you're under a lot of stress from all of this, and sometimes when you're under stress, you can't think right, then the Selank will help with management of your stress that you're going through, and using them together is good. And then if you're had brain injury, like recovery or rehab, like from a stroke, the Semax great to help with the neural repair. But a lot of times when people have had a stroke, they've had personality changes. They have anxiety, they're stressed, they have worry, they have concerns, and so the Selank helps with that emotional support also during that.
All right, now let's get into safety considerations and potential side effects.
Yes. The Semax, it has maybe mild headache initially if you get it, and then it does have a stimulatory effect on the brain. Some people, that's what they like about it, but some people may not want to have the real alertness that you can get. But that does attenuate, as you take it. And generally, you might have a little nasal irritation from it, and that can easily be treated with a saline rinse or things like that to help with the irritation. And then the Selank, again, slight nasal irritation, but generally very well tolerated. And I think the only really contraindication for either one of them is, if you have a severe psychiatric condition, like if you're schizophrenic or bipolar, that not thinking that this is all you need to do to treat yourself, okay? You're going to need a lot of other medications to help with that. Again, the pregnancy and nursing, we just never want to take anything that could potentially affect a fetus. And then if you have uncontrolled hypertension, I don't think it really causes hypertension, but at the same time, we don't want to have any potentiation of that. And then Mayo inhibitors, usage. Because they affect the serotonin system, although the Selank more affects the serotonin than the Cmax. But whenever you are on a serotonin product like citalopram or Prozac, that those serotonin products, if you take it with the Mayo, can cause really uncontrolled hypertension and issues there, and potentially could be fatal. Like anything, when you're taking it, you always want to start with maybe one spray of one product or the other, and then see how it responds. And the nice thing about these products is that you can see a response in 4 or 6 hours, where some you have to wait a week or two to see how you're doing, and then cycle them. You can adjust them, like 4 weeks and maybe 1 week off, or you can, however it is. And then make sure you drink a lot of fluids. Most people don't. And just make sure you give yourself time to have quality sleep, because it does help your sleep. But if you're sitting there and say, hey, I'm only giving myself 4 hours of sleep because I have all these things to do, well, then you're kind of fighting against the medications.
Awesome. Thank you for that. And I do want to stress the fact that the potential for side effects for both Selank and Cmax are so minimal that, like, personally, I've never had any of them. And I don't think that we have really seen many through the clinic, but it's always good to put that information out there. Now we're going to kind of wrap everything up, and we'll kind of touch base on things that we covered in part 1 of this masterclass as well. So we've covered a lot of ground today with these powerful peptides. Dr. Saddoris, let's summarize the key takeaways for our listeners and discuss how they can get started with peptide therapy.
Yes, I think the biggest thing is that understanding what you're wanting to have, what your concerns are, and then basically contacting a provider that is very knowledgeable about peptides and being able to assess your conditions that you have and what your expectations are, and then doing adequate blood work on things to make sure there's not other medical issues that are creating those problems. And then if you do get started on a medication, we usually recommend starting with one peptide before any stacking. So then that way you can measure response. I had seen a patient today, and she had a lot of different side effects from being on low estrogen. And I said, before we go through all that, why don't we correct your estrogen hormonal balance, and then let's see what we're left with, so then we can decide what we need to do next, right? And so, we don't want to over-medicate someone, because then you have these other side effects that you don't know if it's from the primary problem or from the treatment they're giving. So it needs to be a very personalized protocol. And again, proper testing and getting baselines on hormones and maybe biomarkers if they're available, and having high quality products, having them made in a pharmacy that has regulations. The source that you're getting it from, and that you're properly storing the medication, and that you're taking the medicines correctly, and that you have proper follow-up. And like anything, a medicine by itself without doing some lifestyle changes are not as effective. Sometimes we'd rather have one pill to take care of all of our problems, and that's dreamland, right? We need to be responsible for our own body. And so we need to work on getting sleep optimization and stress management and good nutrition and exercise, all the things that we need to do to help our body function. That way, when you have set your goals in the beginning of what your concerns are, then those things can be monitored to see where we're at and what we need to adjust to do that. And then ongoing, review of your health, and I think that provide the support, questions, monitor progress, all of those things, all combined in a comprehensive program to follow, because there's not one size that fits all. And so it needs to be customized person to person, and not one sheet helps take everybody, right?
Definitely. And then the next step in this process, if you do want to work with us at My Body Health and Wellness, we're going to put a link below in the show notes. Just click the link below and that will get you started on your journey with us so that we can help aid you in your wellness journey. So we're going to offer you free consultations there where you can just book a time with myself or Dr. Saddoris to kind of go over some things. And then we'll also put the intake form in the show notes description so you're able just to get that next step going. And if you're ready to take the plunge, go ahead and just fill that out and you're good to go. One last thing, just real quickly, let's just do a very high level to summarize, like in each category, kind of the main peptides that we went over. And that way people can get a nice condensed summary of like, out of each of the categories: sexual function and performance, growth hormone optimization, the tanning and metabolic enhancement, and the healing and regeneration. For sexual function and performance, we covered PT-141. That's the primary choice for libido and sexual function. That's also best stacked with oxytocin, which is the feel-good chemical, and L-citrulline, which kind of gives you the pump and better blood flow. It's ideal for both men and women who are seeking enhanced intimacy. Next, we get into the growth hormone optimization category. And the best there that we found is Semorlin. And that's a secretagogue, which helps you produce your own natural growth hormone. And that's the best in that category. It's best stacked with either CJC 1295 or the GHRP 2 or 6 as well. It's ideal for anti-aging, recovery, and body composition. Next, we'll get into the tanning and metabolic enhancement category. The best that we have found for that is melanotan 2, and there are multiple benefits beyond tanning. That's the one that we nicknamed the Barbie peptide. It also has the benefits of increased sexual function, more lean mass so that it cuts fat as well. It's best stacked with PT-141 and L-tyrosine. It's ideal for skin protection and appetite control. And then today we covered section 4, the healing and regeneration. That would be PDA and BPC-157. Those are complementary healing peptides, and they're both basically best stacked together. Dr. Saddoris did mention the TB500, but she wasn't as big of a fan of that one. They're ideal for injury recovery, gut health, and tissue repair. Last but not least, we did get into the cognitive enhancement section, and we covered Selank and Semax. Semax and Selank are best used together for those potentiation effects for comprehensive brain optimization. They can be used separately with great effect, but they're very, very good synergistically together. They're ideal for focus, anxiety, and cognitive performance. Thank you guys for tuning in. And next episode, we're going to be getting into longevity medicine, how to optimize brain states so that you can achieve flow state pretty much all day long to help you achieve whatever your goals may be. Is there anything else you'd like to add before we hop off, Dr. Saddoris?
No, I think that longevity is so important because we all want to die, what they call die young. Okay, so your body is in a young state, even though we may be in our 90s. So we're having the prime of our life and that we are functioning at our most.
Awesome. Well, thank you again, guys, for tuning in to Activate Your Best Health. Again, feel free to check out the links in the description down below, and we'll see you next time. Bye now.
So you just listened to this episode. Now, join us in being addicted to betterment. Please subscribe to the show, share with your friends, tag us, and please take a moment, leave a review. Yeah, we do want your stars, but we really want the feedback.